Hi again, everybody. Welcome to the Recovery Hour here on Facebook Live. I'm your host, Rod Peterson, a person in recovery. It is episode number 26 of the Recovery Hour, a program where we talk about all aspects of recovery, mental health, addictions, you name it, just getting people better. Pleased to be welcome to our program, our co-host, addictions counselor, Ran Teed. And coming up on the program tonight, a very special guest, friend of ours, a friend of mine. I think you've just gotten to know the Honorable Everett Hindley. Am I right, Ran, Minister for Addictions and Mental Health?
I've had a couple of chats with him. Bright guy, interested in what we're doing.
Really fantastic guy, MLA for the Swift Current area. He'll be coming up in the second segment tonight. I'd mentioned to Ran, do we have a theme for the program tonight? Because we've kicked around a few ideas talking about interventions. You mentioned normalization you'd like to talk about. We'd also like to talk about tonight Carey Price, a very high-profile NHL athlete who entered the Player Assistance Program, completed a month in the program. He is now back with the Montreal Canadiens. We want to talk about that situation too and the effect that has on his life and stigma and all the rest. And the one interesting thing that I've written down here, I don't really know what you were getting at, so I'm going to give you the floor, and that is, you said the pandemic that overshadowed the epidemic. Yeah. What do you mean by that?
Well, there's been a huge amount of attention paid to the COVID-19 pandemic, which is absolutely, that makes absolute sense. But because there was so much attention paid to that, the substance use problem epidemic, which has been going on for quite a while, sort of drifted down below everybody's radar. And in some ways that made things worse. People weren't getting quite as much attention as they could. It definitely became more difficult to get into services. Hospitals were jammed up with COVID issues, so it was harder to get in for a substance assessment. It reduced capacity in treatment centers. Most of them are two-to-a-room facilities, and they had to stop that. So essentially cut their capacity in half, which in turn increased the wait time to get into anything. And not a whole lot changed because of those problems. People, did what they could, but it certainly exacerbated the issues that people were having. And and we've talked about this before, if you're ready to go to treatment and you want to go to treatment and they say, well, you got to wait 3 months, that's a difficult 3 months because you're still battling this demon that you're battling. And, if people could just stop, they'd just stop. But as we know, that's a difficult process for lots of reasons. And so, the inability to quickly access things increased the level of problem. And, as we know, most substance use is stress-related. People have developed the problem because they're using it to manage stress. And when external situations get more stressful, that increases substance use. And because right now there's a very toxic drug supply, that increases overdoses. So it just caused a real downward spiral in success rate, really.
Well, here we go. And I appreciate the guys setting up the comments. A lot have come in already. Mo writing on Facebook, hello, that's right, addicts died. People willing to access treatment were turned away. Sad, really. Todd Rennebaum, who I know just celebrated a sober anniversary here not that long ago. Congratulations, Todd. Proud of you. Congrats on your recovery. Harm reduction. We did cover that last show a little bit.
Yeah, we talked about it. We've talked about it a few times.
Yep, and we could cover it again if you want, Todd, if you weren't watching the last program. But it's about 5 roads just popped up on my mind off of what you just said.
But let's go back to Carey Price. So what did you think? What did you think about that?
Okay, when I heard that Carey Price was going into the NHL Player Assistance Program, what do you think I thought? I thought, good.
Yeah.
First thing I thought was good. But that's a very rare perspective.
So what did you hear about that?
What I heard, from the public or from my inside hockey people?
Both.
We don't want to take Carey's inventory, as they say, but let's just say It was a long time coming because he said that afterwards. He said he
Yeah.
neglected his mental health for a long time.
Yeah.
So I was happy to see that he was finally addressing it. But I was in Florida when it happened, and I was around a lot of hockey people and hockey fans, and they were saying, oh, that's too bad. How terrible it is that Kerry has to access the player assistance program. I'm like, you don't understand. This is a
Yeah.
good, he's going into recovery. I went into recovery. You went into
Yeah.
recovery. Every day since has been great. Here's hoping this is what Kerry needs. But you asked what I thought. When he got out after, let's say, 28 days-ish, he addressed it, took it head on, and said that he sought treatment for substance abuse. And I thought, ooh, you didn't need to say that.
Well, I think there's a huge advantage for everybody to hear that from him because he's
Yes.
a really respected
Oh,
hockey
yeah.
player.
I love him.
And I don't pay a lot of attention
If
to
you
hockey.
know who he is, that's a real big thing, yeah.
Yeah, he's a goalie, right?
Smart and a good person, yeah.
And so when somebody at that level admits publicly that they've had a substance issue and that they're getting help for it, that's the kind of thing that allows other people to say maybe it's okay to get help. Maybe it's okay to talk about this because there's still a huge sense that somehow or another this is something to be ashamed about, and it's not. But our culture has taught people for generations that it's not okay, and that that's just developed, and
Not okay to get help or not okay to have a
both.
problem? Both. Yeah.
Both. And I think initially that's what you and I wanted to really work on with this show was to help in all sorts of different ways change that kind of thinking. Because it's always thinking that causes issues. And thinking is one of those things that we can change.
This is a very important distinction, too, by the way. I don't know Carey Price personally, Rand, but we're in the Western Hockey League at the same time together. I've been around him when I was in Montreal in June. When he got out of treatment and made his statement, there was an article on a website called The Athletic, and the headline was, "The Carey Price You Don't Know." And I immediately got my back up. I thought, you better be good to him.
Yeah.
And I read the article, and it was a very long one, but it basically said, Rand, that being the starting goaltender for the Montreal Canadiens is an incredibly stressful job, and that
Yeah.
Carey had turned to substances to deal with the stress. And
Yeah.
I thought, how common? You know what I mean?
Well, and we've talked about that before, and I just mentioned it a few minutes ago.
Yeah.
Stress is the primary stimulator for substance use. And people start to learn that really young. And that's, if we can spin this into that normalization discussion, our society has really normalized substance use to relax. You had a hard day at work, have a couple of drinks. Now we've had a hard day at work, do a gummy. That's becoming a thing, which
Quite common.
yeah, which worries me. If you're doing a gummy once in a while, it's not a big deal, but you start to do that nightly, and that starts to change brain function, and it starts to change you. And like never from the inside can you see that. Somebody else will have to start to point out, hey, you're different. What's going on here? And then there's always that reflective piece that takes people a little while to start to say, oh yeah, this changed because I started to do that. And it's no different than the people that start to whine a clock.
Mm-hmm.
And that becomes a bigger thing for them, and it starts to change them. But we can never see that from the inside. And with the normalization piece, we tend to be around people who are doing the same thing that we are. Like, it's unusual for people who drink to be the only person drinking somewhere. So they will congregate with other people who are doing the same thing that they are, because that makes it feel okay. And that starts in adolescence.
Mm-hmm.
So, the more we pay attention to limits and what's okay and what's not okay, I think is valuable.
Well, and to just finish up on the Carey Price thing,
Yeah.
Let's be honest. If his life was as bad as he says it was, and I'm sure it was at least as bad, if not worse, he took his team to the Stanley Cup final last year, living in terror. As you know, I heard this once in a 12-step meeting. being an alcoholic, assuming that was his substance, I'm not sure.
Yeah.
But is like being in the middle of a tornado.
Yep.
You know it. And it's, yeah, you don't see the damage you're causing. Your whole life is up in arms. And he went to the Stanley Cup final with his team. So at 33, and I believe his 14th NHL season, I'm thinking if he gets straight his mind right now, how long could he play?
Longer.
You know, a lot longer.
Yeah.
And he is already in that group of names that you would know, Jacques Plante, Patrick Roy.
Yeah.
He's one of the greats.
Yeah.
Battling that for the last 14 years. So how good could he get from here? Now, you had a term that you wanted to, I guess a theme you wanted to talk about, and that was normalization. And you kind of brushed on it here with a gummy at night or a few drinks to take the edge off. How big of an issue is normalization?
Well, it's a huge issue, and it starts in adolescence. So, like I work in 5 high schools regularly. I've been doing that for a long time, and when you start talking to kids, their initial reaction is what I'm doing is okay, and that's the same for adults too. We tend to associate with people who are doing the same thing that we're doing, and then we don't really have a way to look at what's going on and say this isn't okay. Because you'll look at Bill and Bob and Sally and Jill, and they're drinking the same as you are, smoking weed the same as you are. And so that automatically makes it okay. And there's usually somebody that's a little bit worse, and you look at them and say, well, I'm not as bad as them, so I'm okay. But the way the humans are a tribe creature, like we like to be in groups, and we like to be in groups that are similar to us in some way or another. So, like sports guys will hang around talk about sports.
Recovery people hang around.
Recovery
Right?
people hang around talk about recovery stuff, and so. I think there needs to be a bigger sort of public education piece around, like I said before, how much is too much. So I might ask Minister Hindley about that and just kind of see where we're going with that, because we do have a community care branch that's responsible for education. We had the fellow on from there a while ago talking to him. But, how normalized is drinking too much in the hockey world?
Oh, it's not that anymore. It's hard drugs.
Yeah.
It's funny you say that because, by the way, a reminder of Alex Bishop's comment. Guys, keep that handy. I want to read that. This is what I heard. And I don't mind saying it. It is the recovery hour. How much time do we have in this segment? They're telling me, this has been in the media, this isn't telling tales out of school. Cocaine use is so rampant that they tell me that the players will do a couple lines like, we used to do a couple beers. You know what I mean? That's the normalization now is to snort cocaine after a game and then do it all night and then get up in the morning and take a couple bumps to get going, right? And then what it does for you the rest of the day, then you need to drink to come up or bring yourself down, and it's just this constant cycle. And nobody came to me to say, what do you think about it? I kind of overheard this discussion.
Yeah.
And they think that it's a potential problem, but nobody wants to address it.
And do they not do drug testing in the NHL?
For performance-enhancing drugs, but recreational drugs are not under that umbrella.
Okay.
So, but beyond that, people are talking about it secretly in the NHL, but they don't really want to talk about it.
Yeah.
Like any problems, they don't want to talk about it. And that's the other thing I wanted to discuss with you here in this opening segment, is that it's an uncomfortable, all of this is uncomfortable, apparently. Why is it so uncomfortable? A family member's using, a family member's drinking.
Well, it's that shame thing. It goes back to people who have substance problems must be weak-willed or don't have a strong moral compass. Those kinds of sort of traditional beliefs, which aren't true but get stuck with people. And so there is shame attached. Like I'll get parents calling me being concerned about their kid, but they don't want, they don't want anybody to know what's going on. And we've said before, it's really interesting. We've talked about substance use disorders or addictions, depending what language you want to use, as a medical problem at one level, or that whole disease discussion is another one. But if a family member has cancer, you rally everybody around for support, and that helps, because you start to bring positive energy into the situation, and you bring love into the situation, and you bring caring and compassion into the situation, and that starts to create some change. But with a substance problem, as soon as you start hiding it, that starts to create negative energy and shame, and then you won't talk about it. And so that collective compassionate help that can be brought into a situation doesn't happen.
Minister Hindley is ready to join us after the break.
Okay.
So we'll continue this
Do we want to
discussion
do
in a
any
moment.
comments, or we got lots of comments?
We have a lot of comments that we're going to get to as well. Marina says, I'm dealing with stress, but I'm getting better at coping with my biting habit, but it's still very hard for me to deal with. From Alex, sorry?
Lori asked what happened to my arm. I ran into a tree.
Who won?
The tree.
The comment from Alex slipped off the screen. There's another one from Alex Bishop, though. It says, social support systems improve patient outcomes. Alex has a lot of questions, so when we bring on Everett after the break, I'll ask Everett the question straight from you, Alex. Programs brought to you by SGI, in part. Impaired driving is the leading cause of death on Saskatchewan's roads. SGI's Be a Good Wingman campaign encourages people to watch out for each other. Remember, when someone's impaired, their judgment is also impaired. Be a friend for life. Don't let impaired friends drive. Thank you to SGI for their support of the Recovery Hour. And the Minister of Addictions and Mental Health, Everett Hindley, joins us after this break. You're watching the Recovery Hour on Facebook Live.
Bellwood is our Toronto facility founded by addiction medicine pioneer Dr. Gordon Bell. Bellwood's programs are based on scientifically proven best practices in addiction treatment with specialist doctors on site and nurses available 24/7. Bellwood continues Dr. Bell's legacy by combining innovative, medically excellent treatment with compassionate care. EHN Canada. We take care of you.
There's something for everyone at the Mad Greek Eatery. Delicious Greek dishes, pizza, lasagna, pastas, soups, salads, and much more. The Mad Greek Eatery brings the best authentic Greek cuisine right to you. Available for licensed dining, events, delivery, and takeout. For the best taste and huge portions, there is only one place. Visit the Mad Greek Eatery, downtown Moose Jaw. Call for takeout and delivery today.
When I first walked through the doors of Edgewood, I had no idea how amazing my life was about to become. The caring and compassionate medical and clinical experts were there for me and for my family every step of the way. The holistic approach the team delivers is highly effective and addresses the needs of each individual. Edgewood saved my life, and it can save yours too. Visit edgewood.ca to learn how you can thrive in your own recovery.
All right, it's time for me to head her.
Whoa, Dave, come on, man. You should be driving. We've all had a few.
Please, don't be so dramatic.
Dave, give me your keys. I'll get you a ride home.
I'm fine, man. Just back off. You're such a jerk.
If you've been drinking, please make the right choice to get home safely.
You could save a life or an entire family.
Like ours.
Welcome back to the Recovery Hour, everybody. It is our 26th episode of the program here on Facebook Live. Rand Teed along with Rod Peterson. And this month's featured guest on the program is the Minister responsible for addictions and mental health, the Honourable Everett Hindley, who joins us tonight via video conference call. And I appreciate the time, Everett. Nice to see you. You're looking great as always. I said to Rand, I'm going to hand the interview over to him off the top. So you go ahead, Rand.
Hi, Everett. Thanks for joining us.
No problem. Good to see you, gentlemen. Thanks for having me this evening, and thanks for what you're doing.
Thank you.
So, did you watch the first segment?
I did. Yeah, I caught most of it. You talked a little bit there. Interesting, just in some of the recent news here in the professional sports world with Carey Price and just in terms of the conversation that's leading all of us to have, but very timely in terms of what we're talking about here tonight.
So, can you talk a little bit about what the province is trying to do to improve the situation? Because that's something that's on everybody's minds. We've had several comments about wait times and wait lists and those kinds of things.
Yeah, for sure. So I'm going to focus on, and there's a number of areas that that our government's been putting some investments into, new investments this year when it comes to addictions and mental health as well. I think you've probably heard me talk about the record investment overall into mental health addictions and addictions in this year's budget. And into a number of different initiatives, some pre-existing and some new initiatives. Specifically on the alcohol and drug services portion, though, the Ministry of Health is allocating about $62 million this year into that area. It includes things like outpatient and residential and drug treatment services. There's a number of harm reduction initiatives, which we've talked a little bit about in terms of that is part of the government's plan in terms of what we're trying to do to provide supports, because there's a number of areas we're trying to get to, right? There's, as you folks have talked about, and what your show is focused on is on treatment, and there's roles for other parts of this as well on the harm reduction side. But specifically on the treatment side of things, we have, we would have announced a couple of years ago an expansion into some additional treatment bed capacity at the Crystal Meth Treatment Center in Estevan. In this year's budget, there's funding for an additional 12 beds to be added to that, bringing our provincial capacity to about 487 beds right now. But most recently, though, it was an announcement in this fall's throne speech at the end of October, where we announced that our government has a goal and a target of adding an additional 150 treatment spaces in this province over the next 3 years. So that's a significant number. We know that we've got some wait times and waiting lists that we have to deal with, and we're hopeful that that's a start towards trying to address some of those waits.
I know in the harm reduction world, one of the things that got added not too long ago was the rapid access addiction medicine centers. How have you felt that those have been helping?
Yeah, those have been working well, Rand. These are something that started a number of years ago. We have 4 of them operating in the province now in different communities. Thanks for highlighting that, because that is part of our overall addictions strategy. It's yet another tool in the toolbox to use an often overused phrase, I think. But what we've been trying to do through whether it's the rapid access to addictions medicine clinics or some of the other harm reduction initiatives is we're trying to provide supports to as many people as we possibly can across this province, regardless of where they live, because We know that this isn't just an issue focused on our major centers. This is, and of course, the numbers are higher in Regina and Saskatoon. But that being said, we know that this is something that our friends, our families, our neighbors all struggle with across this province in major centers, small urban centers, rural centers, northern and remote First Nations communities as well. So the rapid access to addictions medicine clinics are an important part of that, as are some other recent initiatives that we've announced this year. For example, the drug checking strips that we announced in August, and then more recently talking about the government now going through the process of procuring some spectrometers, drug checking devices. We're going to start with, we have some funding set aside to purchase 3 of those. But yet again, in addition to the RAM clinics, some other tools that we can use to help people that are faced with some of these challenges when it comes to addictions.
And I guess the other piece that's pretty important is public education about substance problems. If we don't pay attention to the development of a problem, they're always going to get worse before they're recognized. So, like any medical issue, early diagnosis, early intervention creates much better outcomes. So, where are we on sort of better public education on how much is too much, or that kind of issue?
Yeah, it's a great question, Rand, and that's part of it as well. Is the stigma reduction and public education piece of this? It's why also in this year's budget we allocated some funding for a targeted campaign, a public awareness campaign that launched at the end of August in partnership with the organization Mums Stop the Harm. You may have seen some of the ads on the internet, and in addition to that as well, or in conjunction with that, we also announced the launch of a website specifically to deal with overdoses on the provincial government website that provides sort of a one-stop shop there for individuals to find information about supports and services that are available. Things like what might be available in your particular community in terms of support services that are there. A map of where take-home naloxone kits are available, for example. That's another thing I didn't mention either. Is we're also expanding and trying to expand the take-home naloxone program so that we can make that more readily available in more communities across the province. So, but you're right. The communication piece and the public awareness piece is key on this. We talk about that when we talk about suicide prevention and mental health issues, and addictions is part of that as well. Where and I think that people we're starting to recognize that this is a lot closer when it comes to addictions than perhaps people perhaps realize.
And like addiction typically is a pediatric onset issue. Like it starts in adolescence. If you look at the statistics, 95% of people who develop substance use disorders have started before they're 17. So much of that education piece needs to be for parents and directed at adolescents. So have you looked at that?
For sure, yeah, and prevention is key. That's the other part of it, right? We focus a lot on the treatment side of things, and that is important. Of course, it is. Because that's the ultimate form of recovery, is to make sure that people have access and the ability to get the treatment that they're looking for. But if we can provide the supports that we need to, and the education at a younger age, and those are some of the conversations we're doing a little bit of that right now through a cross ministry collaboration between our ministry and education. The Ministry of Education is in this field as well. But I think that's an important point you made, because prevention is very important to this, and I think if we can try to help provide people with the information and the supports at a young age. Just think of how life-changing that can be to perhaps prevent even just one individual from perhaps reaching a point in their life where they might require treatment. So prevention is it's so key to this as well.
Everett, I've known you since Swift Current days, and you're still a Swift Current guy, although I see you're in your office tonight.
Yeah,
it's interesting with the prevention piece, because were you born and raised Swift Current?
No, actually, Melford area is my hometown.
I didn't know that. So the reason I ask is I was out in Swift Current speaking at it's the comprehensive school, isn't it? Swift Current Comprehensive,
High School.
Yeah, and it was interesting because I never touched drugs because a guy came to my school when I was 9 and said, if you touch drugs, they'll ruin your life and you'll never be able to quit. And I'm good, done. And I never did. And I went to Swift Current, and I don't know if you knew this. They brought in 700 kids into the comp gym. I gave my presentation, moved them out, brought in 700 more like that. And we hit 1,400 kids in a couple hours. And I just thought that Rand has often said to me, the number one weapon against addiction is prevention. Number one, right? And I just think hitting kids with, is great. And it was nice to get into Swift Current. But my follow-up question has nothing to do with that. You guys have been talking about drugs and treatment and all these things, but the mental health component of your portfolio, while addiction is a mental illness, what have you, and what, by the way, that's why I think this show is so great, the educational piece of this. Not many people would know that addiction is a mental illness, but the others, how have you got up to speed on that in the last year since you took this portfolio over? Because it's big, it's immense, right?
It is big. Well, and the thing is, they're intertwined, right? They're interconnected. Like that's the thing. And I think you're seeing. I'm fortunate. I get to serve as the first minister of mental health and addictions in this province. It's a new portfolio that was created a year ago. You see other provinces getting into appointing ministers in this area as well. And recently, the federal government has appointed a federal minister of mental health and addictions. And I had a chance just briefly to have an introductory phone call with the Honorable Carolyn Bennett just shortly after her appointment. And as she was reaching out to her provincial and territorial counterparts across the country recently. But yeah, on the mental health side, and this is, I could bridge to this a little bit too, from the education and prevention perspective. We're doing something right now called a pilot in a handful of schools in Saskatchewan called a mental health capacity building, which is focused on preventing or providing mental health supports for kids at a young age. And then also, something that we funded in this year's budget that we're going through the process of getting off the ground now too is something called the Integrated Youth Services Project, which is based on a model from, I think it's BC actually, and where you try to eliminate some of the silos, right? You have various ministries of government, social services, healthcare, education, all those, justice, corrections, and policing, as well as community-based organizations and the school system and all that stuff, again, providing kind of wraparound supports for kids. But just to go back to your initial question, so much of this is connected because often if you really want to get at least in my view, at making some real important change when it comes to the addictions file, you often have to get to the underlying issue, which is usually, and the perfect example is what you talked about with Carey Price and there's countless other stories out there, that don't involve famous professional athletes or superstars around the world, but there's often an underlying issue that leads to these other things. And it's a mental health stressor. Perhaps it might be something like a domestic abuse situation, right? Or perhaps, a kid's growing up in a family where alcoholism has been there for a long time, and so you really have to get at those issues if you want to truly get at the addictions piece.
Good for you, Everett, for addressing that.
There's a couple of questions about Pine Lodge. I know you're well aware, I think, of what's going on there. They had a fire last Christmas and then ran into some zoning issues and whatnot. Can you update everybody on where things are at with that?
Yeah, my understanding, Rand, is that there were a couple of different locations they were looking at, alternative locations. Initially, my understanding is when the fire, when that tragically first occurred, there was some, they were looking at repairing the facility and rebuilding. I believe it was quite extensive, I think. But last I heard, and I stand to be corrected, but last I heard, I think the folks at Pine Lodge did secure another facility. In terms of where that's at, in terms of reopening, I'm not sure exactly where that's at, but I think it's in the not too distant future. But I think we will hopefully see a resolution to that, hopefully fairly quickly, and that should be reopening.
I think you're correct on that. I believe there's just some. They have a facility in Regina. They're just doing a few renos and some code upgrades, and then should be ready to go fairly soon. So that'll be a nice addition. So I know both BC and Alberta started providing provincial funding for some beds in private treatment centers. And I know we don't really have a lot of private treatment centers in the province.
Yeah.
Have you looked at that possibility just to take some of the pressure off?
Right. So that kind of ties into the throne speech announcement, the 150 additional spaces that we plan to add over the next 3 years. What we're doing is, we've asked the ministry to come up with a bit of a strategy as to what that might look like. Because we know that there are, in addition to the treatment beds and spaces that are currently operated by the government of Saskatchewan. I listed some of those earlier when it comes to the Estevan model. We recently announced, I forgot to mention this, speaking of Swift Current, a number of youth addictions treatment beds that just opened just this fall in Swift Current, not just serving folks in Swift Current and Southwest Saskatchewan, but youth across the province. But on the 150 treatment spaces, we're asking the ministry to take a look at how could we potentially, in order to reach that target, how could we potentially look at hitting that number? Does that involve using some third-party organizations that are already in this field, whether they're private-based or faith-based, whatever they might be? And there's all different types of models. Rand, you'd know this far better than I do, but and that's the thing, right? The thing that that is important to remember about this is there's no one size fits all solution to this, and that's what's key. And I think you and I have talked about this previously, but gone are the days of the old 28-day style treatment programs, which were used to address some of these challenges. We've got people that, and this is the way it needs to be, that once you enter treatment, you're there, and as long as you need to be there. And there's no end date on that. If it's 28 days, if it's 50 days, if it's 150 days, whatever that might be. So anyway, so we're looking at all of what sort of creative options we might be able to use and capitalize on in order to reach those 150 spaces. And we're just in the process of kind of putting that together, what that's going to look like, and then we'll be able to detail that a bit more publicly in terms of how we're going to achieve that and where we might be looking for some partnerships.
Great. Yeah, I was out at the new youth treatment center in Swift Current. I did a little bit of training with their staff, and it looks like a great facility. I'm really encouraged. I think we're out of time.
We are.
I'm getting waved at by Rod. So
well, I just want to say
you're getting the
Hey, Everett. But I will say this: you've done a few interviews in your day. You've been on both sides of the microphone. So I'll say, is there anything else you'd like to add that we didn't cover here tonight?
No, well, there's so much we could talk about, gentlemen. This 20 minutes has flown by. This is, I guess what I would say is, and you guys kind of touched on this off the top, how we know the numbers have gotten more challenging partially because of the pandemic, and we see that not just in Saskatchewan. Provinces across this country are seeing rising numbers, and even in the United States today, in terms of they announced in the news a number of overdose deaths. This is something that is really across the globe right now, and we're all trying our best here, I think, to try and to work with each other and find the best possible solutions that we can. And I think, again, remembering that these are people, right? Yeah. These are people we know. It's our family members, coworkers, neighbors that are, and sometimes people you don't think of, that you think are putting on a brave face and everything's going just tickety-boo fine in their world. Yeah, right, exactly. And you just never know. And that's why it's important that we talk about it. And then in addition to that we act on this, and we're trying our best as a government to try on the treatment side of things to make sure that we can address some of these wait lists that we have. Some of the gaps, we hear that as an issue in terms of, when people being able to walk from point A to point B to point C, so that they don't fall through the gaps during that treatment process. But I'm encouraged that we're on the right path and working with great organizations and gentlemen like yourself on it.
Thank you, Everett. And as I say, this government is putting its money where its mouth is, and it is very much appreciated by the recovery community. Thanks for the time, Everett. Hope to see you soon.
Thank you.
You bet. Thanks, gentlemen.
The Honourable Everett Hindley, the Minister responsible for addictions and mental health. And on that topic, EHN Canada is Canada's largest and leading provider of private addiction and mental health treatment. EHN Canada's treatment facility in Calgary provides a peaceful, comfortable environment with industry-leading medical care from doctors, nurses, and counselors. It's called Sandstone, providing an innovative, structured treatment program and excellent food prepared by a passionate chef Sandstone offers a safe place for recovery. They are accepting new patients, and they look forward to helping more people recover in the new year. Learn more about the EHN Canada Sandstone Treatment Centre from their website, ehnsandstone.com, or call 866-428-2261. EHN Canada, we take care of you. The Recovery Hour continues after this break, and we'll be answering your questions right after this pause. You're watching the Recovery Hour, episode number 26 on Facebook Live.
All right, it's time for me to head her.
Whoa, Dave, come on, man. You shouldn't be driving. We've all had a few.
Please, don't be so dramatic.
Dave, give me your keys. I'll get you a ride home.
I'm fine, man. Just back off. You're such a jerk.
If you've been drinking, please make the right choice to get home safely.
You could save a life or an entire family.
Like ours.
Nestled in a quiet, peaceful Calgary neighborhood, Sandstone welcomes you into a warm environment that feels just like home. Our detox rooms, common areas, and private rooms are all designed to ensure a comfortable and relaxing patient experience, with minimal distractions and triggers. Sandstone's inpatient programs are supported by a high staff-to-patient ratio composed of physicians, on-site psychiatrists, social workers, nurses, and psychotherapists who have extensive experience and expertise in the treatment of addiction and concurrent mental health disorders. You'll receive individualized attention from our industry-leading medical team, a calm, peaceful environment, and excellent food prepared by our passionate chef. EHN Canada. We take care of you.
There's something for everyone at the Mad Greek Eatery. Delicious Greek dishes, pizza, lasagna, pastas, soups, salads, and much more. The Mad Greek Eatery brings the best authentic Greek cuisine right to you. Available for licensed dining, events, delivery, and takeout. For the best taste and huge portions, there is only one place. Visit the Mad Greek Eatery, downtown Moose Jaw. Call for takeout and delivery today.
Welcome back. The Recovery Hour continues on Facebook Live. It is our 26th edition, and we've got plenty of time in our final segment for your questions. And yes, if you're watching on YouTube or Facebook, you can certainly comment there. You can also do anonymously on our text line. The number is 306-552-HELP. That's 306-552-4357. We'll be taking your questions right up until the top of the hour, which is 8 p.m. Central. And some of these comments are slipping off the screen. There's a lot have come in tonight, and we appreciate you watching and commenting. Todd and Tanya McNeese write, how can we plan to provide aftercare for when people are finding clean and sober success in treatment and are sent to figure this life thing out on their own?
Well, I'm not sure that that's entirely true. It is certainly in some cases, but most treatment centers try and coordinate some sort of aftercare programming, and it's definitely something that had been slipping through the cracks. But I think I think there's an attempt to do a better job. I know 2 or 3 of the treatment centers that I work with have a pretty rigid aftercare program set out for people for when they come out. Because Todd or Tanya, whoever said that, is absolutely right. If you go to treatment and then just go back into the environment that you came out of, the risk of relapse is really high. And recovering from addiction is really about learning to think differently and then practicing that new learning to think differently over time so that it becomes a pattern. And so that's what aftercare programs are designed to do, is to help people stay on track so that their new recovery lifestyle actually becomes them. It becomes the way that they deal with things. And that takes time. And I know back in the 10-year action plan for addictions and mental health that came out, I don't think it was 10 years ago, but a while ago, that was one of the things that was noted that was missing. So there have been some attempts to manage that. I know Addiction Services in Regina has a sort of an ongoing once-a-week aftercare relapse prevention meeting for people, and as anything, it's voluntary. So there are programs out there. Most people, when they go to treatment, have been referred by a counselor, a psychologist, a social worker, and often it's really useful to stay in contact with that person and continue to work with them. Even though they may not be an addiction specialist, they can be very, very helpful in checking thinking, teaching you other ways to manage stress, those kinds of issues.
Mo Custer says health prevention and promotion is still the best approach. Band-aids are not working. Saskatchewan is going to greatly change if we don't start treating the core of our issues. Sounds ominous.
Well, and I think she's right, and that's what we were talking about with that normalization piece. We've normalized, sort of excessive substance use in our society, and education is the thing that helps to change that. I've been working on that in schools for a long time, like 20 years specifically, just on drug, alcohol, and mental health issues. And it does make a difference, because if people don't know something, they're going to just do whatever. Like I had a group of kids the other day, and we did a substance use screen with them, and several of them scored relatively high. And we talked to them afterwards, and they said, this was really helpful for me because I didn't know I was doing it too much. I was just doing what everybody else was doing. But so helping with that education piece is really valuable.
Troy in Toronto watching says, I can't speak for Saskatchewan as I'm from Toronto area, but I was faced with a decision to enter a private or government treatment center. I was prepared to spend thousands of dollars at a private facility and feel blessed to be able to make that choice. But unfortunately, that is not a choice for the majority. He goes, why do we in Canada not see mental health and addiction in the same light as physical disease? What are some ways we change that mindset in our society? Troy, by the way, is with Sober Athletic Wear. Give them a follow on social media and order some of their items, the wonderful athletic wear, Sober Athletic Wear.
And I think that's what we're trying to do is raise the level of awareness about this stuff so that things change. And really the way things change in our society is if enough people start insisting on getting help. I know one of the Giuseppe at the last store? Yeah. One of the things that he's been saying for years is we need to be able to pay for addiction treatment with our healthcare card, not our credit card. And so, I think we're moving in the right direction, but it's still going to take some time.
We have plenty of time for your questions because we could certainly fill it on our own. I don't know if we brought this up last month or not. I don't think so, Rand. I was posed with a question in a group setting. They said, if you purport the disease model, which I do, and I think you do,
Yeah.
they said, how then do we draw a line in the sand with the addict, alcoholic, and say enough's enough if they're battling a disease?
Well, just like if you have obesity, one of the ways that you start to battle that is help the person understand that they have to change their caloric intake, if they want to get better. One of the fundamental problems with addictive disorders is the use of the substance changes the person's capacity to make decent decisions, particularly about themselves, because it is filling a whole bunch of needs for them. In lots of ways, it's their best friend. And so helping somebody understand that they've got to move away from that is a really difficult process. And, which is different from a lot of other diseases. Like, you don't like having cancer. You don't like having diabetes. You want to treat that. But at a very strong emotional level, we like what substance use does to us, or for us, depending on how you look at that. So it is a significant brain issue, and that's where that disease model comes from. Is that it is a brain disease. It's a disrupted reward system, or a dysregulated reward system, and so. Helping everybody, whether it's family members or the person with the problem or the public in general, understand that that's what we're trying to deal with, it is really important, because there's still that belief, well, they should just smarten up and quit.
Yeah. But there's a quintessential moment in that, and I think why we can just talk about our own personal experiences, I think it helps. My very first session with a counselor, very shortly after he told me I would be dead in a year if I continued the way I was going, my mind was racing. You know that look?
Yeah.
And he blurted out, "You have a disease, Rod." I'll never forget it. It was like a light bulb went off. And I was like, what? And he went on to say that alcoholism was designated as a disease in the 50s by the American Medical. Yeah, medical. I'm like, what? And the more he talked, I said, "Are you telling me that this is really all in my head?" And he goes, "That's what I'm telling you." And I said, "So if we work together, we could overcome this?" He says, "That's exactly what I'm telling you." So that was just my light bulb moment.
Yeah, and I mean, and the fundamental decision needs to be, I want to get better.
Which it was. Yeah. Which that's why, back to the Carey Price thing in the opening segment, that's why I was happy to hear he found recovery. Yeah. Because so many people don't. But how many people said when they heard Carey Price was entering the Players Assistance Program, which we covered this, by the way, with Everett. Carey Price's wife put in an Instagram post before he went into treatment that he was going for mental health issues. Mm-hmm. And I thought, addiction's a mental illness, right? Well, they're kind of couching the terminology there. Yeah. And it was just interesting that 28 days later, he's out and he says, "I'm in for substance abuse." Yeah. And I thought, wow, again, he didn't have to do that. But I guess you just pray that the light bulb goes off for people. Yep. And it sounds like it did for Carey Price. Angie Hicks writes in, she says, "So many people are suffering, not just those with the addictions, but their loved ones too. And boy, oh boy, are they ever. I mean, we could talk about this being a family disease. That could be a whole other show."
Yeah. And then Alex says, get groups of people together who will speak to their MPs and MLAs and get commitments from them. And that grassroots pressure is so important in changing things. Like if governments start to recognize that there's a whole lot of people yelling about trying to get help for their loved ones, that will make a difference. And one of the interesting things, and I was going to say something to Minister Hindley, but we ran out of time. There's been so much focus on opiate use disorders and the opiate overdose situation. Not that You know, not that that's not serious, but that's allowed a whole lot of deflection away from other substance problems. And people are looking at the opiate overdose thing and thinking, well, I don't do opiates, so I'm not at risk for that, while they're drinking too much or using another drug too much or doing cocaine or whatever. And so, you know, I've said before, like, we really have to get to the point where we're looking at the name of the drug doesn't matter. Like, it's not the drug that's the problem, it's the problem that's the problem.
Addiction.
Yeah, addiction.
Last comment from Troy, and it's a good one. He says, do you think we could introduce CBT, DBT, ACT, which are all therapy models, into health class in high schools to get kids' minds prepared and educated for mental health or illness that may come their way, and not rely on substances to self-medicate? Is prevention the future? You must have thoughts on that.
Well, I just introduced a mindfulness program to all the teachers in the school division that I work for. And they're encouraged by their administrations to start using it at the start of their classes to help kids learn that they can self-regulate, that they can manage their stress in other ways. And it's been really interesting. The teachers that I've talked to who are doing that, who didn't know anything about it before, are saying, like, this is amazing. Like, kids are settling down faster, they're paying attention better, they're more relaxed, and it takes 2 or 3 minutes at the start of class. CBT and DBD are much more complicated processes, but lots of teachers subliminally work some of that stuff into what they're teaching to help kids learn how to manage their thinking, because really that's what it's all about.
Well, if the school boards approve it, I'm all for it. I just know there was 2 school divisions in 2 school years ago, one being my former one, Prairie View, where I went to school, introduced a currency business money managing class, and it wasn't popular enough, and they dropped it after a year.
Yeah.
So I'm just wondering how far this would go. But if they're having success in it,
well,
then
it's working.
Yeah.
And the kids like it. Like, kids are asking for it. Like, I've talked to lots of teens too, and they're saying, you know, I didn't really know if I'd like this, but I actually realized that it made me feel better. And if we can teach people that, that's really important.
No doubt. Any last thoughts before we let the people go?
Just that idea of you know, waving your hands around and saying we need to pay more attention to this because it's really important. And that comment of Angie about family members, like, for every one person that has a substance problem, there's 5 or 6 other people who are really emotionally affected because of that problem. And that affects their productivity and their sense of happiness and their ability to sleep and all that kind of stuff too. So it's a big deal.
Appreciate the time, Rand, as
Thank
always.
you.
It's been fun.
I love doing this.
Yes, great one tonight, and thanks to the Honorable Everett Hindley as well, Minister responsible for addictions and mental health, for his time tonight. Thank you, everybody. You can follow Rand and I on all the usual social media at Rand Teed, at Peterson Recovery, and we will see you next month on the Recovery Hour here on Facebook Live.